Welcome back, everybody. We have another great episode for you today. This podcast is where we uncover the stories behind thriving businesses and bring you expert insights straight from the source. And I'm so excited to talk with our guest. His name is Derrek. He owns a company called Enbalance Bodywork. How you doing, Derrek?
I'm great. How are you?
I'm doing awesome. I like everything behind you. All
Oh,
the skeletal, yeah, and I like your logo too as well. So, welcome. We're excited to have you share your business with our listeners. But so before we go forward, from behind the scenes experiences to valuable advice, this podcast is your go-to resource for learning about the businesses that shape our communities and discover how to make the most of their services. And if you enjoy this content, I'd want to hear more, of course. Be sure to subscribe, like, and even comment on these videos. So, with that being said, I want to kind of dive into and get to know Derrek a little bit and let him tell us about his background.
sure. So it's a kind of a long story. How do I shorten it? Really, just my background's in clinical massage. I went to massage school. I got hired at a rehab center. They told me this is not a spa, so people come in with injuries. I took a lot of different classes, medical massage and um, cupping and things like that, stretching classes, and then I took the technique that I do, which is called Rapid Neurofascial Reset. I learned it in Canada, and they've come down here. I've learned from them, and people started getting better. And basically just getting the nervous system to turn off pain receptors, and it really works.
I like that. And when I was looking at your website, about Enbalance Bodywork, you specialize in practice in providing chronic pain, relief for chronic pain, and improving the overall mobility. Can you expand on that a little bit?
Yeah, so there's a lot of things that I treat that I can't necessarily fix. I've had clients with MS, fibromyalgia, they have autoimmune conditions, really just chronic issues. And I may not be able to cure those things, but I can treat their symptoms. And I have a handful of people that I do see that I tell them I can't cure this, but I can treat your symptoms. I can make your life better. It's people are dealing with pain issues from all different. You never know what's going to come into your office. I have people from all different ages, different backgrounds. If I have a holy book day, it's going to be different. I'll have an 8-year-old. I'll have a 90-year-old. I'll have people that play sports. So just helping them just live better.
Interesting. And I know, living better and going through that chronic pain is so important. And what you do to try to help that is awesome in itself. So, what is rapid neurofascial? Help me with that. Neurofacial or fascia?
Yeah, neurofascial reset. Neurofacial reset's a very confusing bit of neuroscience. So basically, the highest concentration of pain receptors are actually on the outer layer of bone. So that's why, like massage, it's not as effective. When someone goes to a spa and they want what they say deep tissue, they mean like they want you to get to their bone. So like I'm actually stimulating an inflammation response to get it to turn off pain receptors, and it works. I do everything over clothes. There's no lotion. It's a bit uncomfortable of a treatment, but the relief is always better afterwards.
So, what can it actually help with?
Frozen shoulder, sciatica, plantar fasciitis, migraines, knee pain. There's a smaller list of things I can't treat. I can go like I don't treat gout. That's uric acid crystals in the joints. I send that to acupuncture. Dupuytren's contracture. It's not a painful condition. It's just the tissue in the hand gets really restricted. Um, yeah, I can treat almost anything. If it hurts, I can help.
So you mentioned plantar fasciitis. Can you explain to our listeners what that's all about in case maybe someone's having to deal with that?
Yeah, absolutely. So it's just inflammation on the plantar apparesis of the foot. But really, the main issue is along the superficial back lines of the calf and hamstring area. Most people who have really bad cases of plantar fasciitis, if they have a really restricted calf. That's why they go to a surgeon, they get surgery, and it doesn't always work. It's because the issue is higher up on the leg, that whole line. So I treat the whole thing. I get people better. I never see them again for it. I have a 95% success rate with it. It's something I specialize in. So if you know someone considering surgery for plantar fasciitis, have them give me a call.
Perfect. So what are the symptoms if someone is having these issues? What can they look for?
A lot of pain on the bottom of their foot. The worst in the morning when you wake up in the morning and you put your feet on hard floor, it's awful. It gets a little better throughout the day, but it's just really bad pain on the bottom of the foot. And it's so bad where if you just touch their foot, I have to peel my clients off the ceiling. I know they have it.
Oh my goodness. And I know you're dealing with a lot of clients or patients, however you want to structure that. So is there a story, something you can share? You don't have to mention, of course, don't mention who it is, but just kind of a story that really kind of really lets our listeners know that this is something that you helped with that kind of resonates with you.
A plantar fasciitis story or just any client?
Any client, anything that you want to share that stands out.
Um, I've had quite a few. I mean, I've had people it affects their life. I mean, I've had people drive 4 hours to come see me. I've had plantar fasciitis cases that were so bad that they couldn't even, they had to crawl on their hands and knees in the morning to go to the bathroom because they couldn't put any weight on their foot. I've had people admit to me that they were contemplating ending their life because their pain was so bad. I helped them, with that. So it feels good to save someone's life.
Yeah, that's definitely a very positive thing that you're doing. So, this there are people who are listening to this that want to know, maybe there are some different trends technology wise that's kind of being bought into your industry. Anything that stands out that you're seeing?
You mean like techniques?
Techniques,
Yeah.
trends, technology, anything is making it easier for you?
Yeah. I mean, for me, everything is just going down to having a therapist that knows what they're doing and can touch the right areas. Everybody's hopping on the ice trend, or there's the shockwave therapy. There's a cryotherapy trend a couple years back. Cupping was really popular when the Michael Phelps was swimming with cup marks, and people are like, "Oh my gosh, what is that cupping?" It's just people are looking for the next thing, and they want a quick fix. A lot of people just want something fast. That's why surgeries and pills are so popular. They just want something quick and fast, and but I'm really looking for those people that are looking to invest into their health and are willing to make the necessary lifestyle changes to make their life better.
I like that are willing to make the necessary lifestyle changes to make their life better. And there's never something that is quick when you're dealing with that. So yeah, I think you said it best. So there are listeners also that are wanting to be aspiring entrepreneurs, Derek. They're wanting to, maybe they are business owners and they're kind of struggling, or maybe there's someone that wants to be maybe in your industry or a business owner. What say you in terms of giving some advice?
I actually had a therapist. She's a client of mine actually, and she's going to massage school and she wants to learn what I do. And I always tell people that you get paid in proportion to the difficulty or problems you solve. Expert problem solver. Um, Find a problem that you're very good at solving, and then learn how to run a business and to market that solution. I'm a problem solver. I've had people drive 4 hours to come see me because they're not getting the results at Massage Envy where they live because they're not trained to do that. They went to this person, that person, and had whatever technique, and it didn't help them. But would you get those people that are willing to, you know, invest into themselves and do the work? So basically, yes, I would tell them just to become an expert problem solver, and you will always have a job.
I love that. And it seems like if people are coming 4 hours to see you to help fix their needs, that means that there's some type of relationship that you've built with your patients or with your customer to get them to come back, because you're addressing those underlying causes, I'm assuming, that really, and you're talking them through, how to take care of themselves, so forth and so on. So, kudos to you for doing that. That's awesome.
Yeah, good.
So one other thing I want to mention, as we wrap up here, could you provide our listeners with a phone number as well as a website to get a hold of you?
Sure. Phone number is 407-801-8502. And then the website is enbalance.com. Quite simple. I'm also on Facebook and Instagram. People feel free to reach out to me. I'm happy to answer any questions and point them in the right direction.
Well, Derrek, it's been a pleasure. Thank you for taking time out of your busy schedule to talk with our listeners, to share your business practices, and to share with them your services as well. And we wish you much with your business.
Yeah, thanks, bud. It was great to be on here.
You're very welcome.
Thank you for tuning in to First Media Consulting Podcast. If you enjoyed the podcast, subscribe today. To nominate a business you would like to recommend to be on our show, go to firstmediaconsulting.com or call. Thank you for listening.